You say there's a lot of people that it affects their self-esteem, having this gum disease. Tell me more about that.
Well, you know, when people have gum disease, a number of things happen. First, their breath isn't so fresh anymore. And it can be a subtle thing. Maybe their spouse tells them, you know, go back in the bathroom, brush your teeth. But as we said, as much as you brush your teeth, you can't get rid of the bad breath many times. So what happens? You don't want to be in a social situation. You withdraw. Maybe you're on a job interview and you're sitting across the desk wondering if the person, you know, can smell your breath.
Wow.
As the disease...
So they tell you this on consults?
Oh, yeah. When I ask them, you know, what can I do for you? Or, you know, what are your problems? What can I do to help you? They'll say, oh, my breath is terrible. No matter what I do, I can't get my breath fresh.
I mean, is it that simple? Am I oversimplifying, I guess, the explanation? I mean, you're kind of zapping it out.
It's really very straightforward.
It's the bacteria. You're killing the bacteria.
The laser
so all tooth loss is basically from this bacteria that eats away at the...
All tooth loss from periodontal disease is from the bacteria getting under the gum, setting up this process in the bone whereby the bone is destroyed and eventually the teeth are lost.
So the public has two choices, and I'm sorry to interrupt. Scrape it out, cut it out, or get a laser and remove it that way. Is that right? Am I understanding it correctly?
Right. I mean, the essence is the same. Whether you're treating it with surgery or treating it with the laser, what you have to do is get rid of the diseased tissue, get rid of the bacteria, get rid of the tartar, and make the pocket shallow. So when you do cut and stitch gum surgery, we're opening the gum, we're scraping out the bacteria and the tartar, and we're putting the gum back many times higher up on the root, so there's more root exposed, but the pocket is shallow. The laser is doing the same thing in a different way. The laser energy is killing the bacteria. It loosens the tartar from the teeth so we can remove that. And then you go back in with the laser on another setting, and the laser, in effect, heats the blood and connects the gum back to the root of the tooth. So after you treat someone with the laser, you don't have all the recession that you have typically after conventional periodontal surgery. You don't have the cold sensitivity. And those are the things people always complained about long term.
So with the old, one of the drawbacks with that root planing or that scraping and cutting procedure is they may end up with cold sensitivity.
Exactly.
So why does a laser that doesn't happen so much?
Because after traditional periodontal surgery, there's a fair amount of recession of the gum. So either we intentionally move the gum up, or because we've reflected the gum from the bone, exposed the root, taken away some diseased tissue, there's more root exposed. With the laser, we're not lifting the gum off the bone. We're not cutting away, you know, big pieces of diseased tissue.
So the root is sensitive.
The root's very sensitive.
So if you have cold sensitivity, meaning fluids are leaking into that direct root, you have a problem.
Yeah, it's very sensitive.
Interesting.
Many people, you know, won't eat ice cream, won't have cold drinks, and they suffer with it again because they wanted to keep their teeth. But
because the gums have
reconnected to the tooth.
Okay. And if it's cold, I mean, I'm sorry, if you have cold sensitivity, the gums have kind of moved away from the root.
Gums have receded. They've moved up, or they've exposed some of the root so that now it's more sensitive. But that
can be stopped. I mean, it's simple. I mean, it's just early treatment. Is that the key? I mean, if you see bleeding gums, go in.
Right. Most people, because they think bleeding gums is normal, ignore bleeding gums. And then it festers until eventually people have bone loss around the teeth. And then either they realize they have a problem or they go to their dentist who tells them they have a problem. And by that point, they have bone loss around the teeth, they have deep pockets, and that whole cycle of destruction has started.
We're going to take a quick break. You brought these photos.
Yeah.
And some are very graphic. So I should say if you're squeamish, you don't want to watch this next segment. But the afters are fantastic. I mean, cleaning up their mouths with what? How many treatments, by the way? Like 1 or 2 treatments?
That's the beauty of it. You know, with conventional periodontal surgery or that type of therapy, sometimes it would be 6, 8, 10 treatments. With the laser, at most, usually it's 2 treatments. So you can reverse, you know, 20 years, 30 years of periodontal disease in 2 visits, and people are on their way again.
Okay, and by the way, you mentioned something. I didn't know this was a big, puffy pink gums or red gums. The laser would take care of that as well.
Right? The laser would...
And reduce that inflammation?
The laser would take care of that inflammation. The laser, coupled with, you know, proper cleaning of the teeth, proper oral hygiene at home, restores health to the gum, sure.
Okay, we're going to take a quick break. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, before and after photos that are very, very dramatic. We'll be right back.
This is the video animation of the FDA-cleared periodontal procedure called LANAP, an acronym for Laser-Assisted New Attachment Procedure. The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with gum disease. With us we have Dr. Scharf, a board-certified periodontist. Okay, you brought some photos.
I brought some pictures I wanted to show you. This is a woman who's going to have conventional periodontal surgery, and she had deep periodontal disease on these teeth, didn't want to lose those teeth. Now,
Wow, what's going on there?
well, the first part of periodontal surgery is that you lift the gum up from the tooth, exposing the whole root of the tooth and the bone.
Okay, so that picture right there, I'm looking at. Did you cut away the gum, or it's being lifted up?
It's being lifted up like you could lift up a window shade. It's reflected from the tooth. After it's lifted out, we scrape out all the diseased tissue. We scrape the tartar off the root of the teeth. And then here's the last picture of the gum being stitched back in place.
Okay, so this is the standard treatment
Right.
of gum disease.
Yes. And you may say again, boy, why would anybody do that? But again, it gets back to nobody wants to lose their teeth. I mean, could you imagine, you know, going for a job interview and having to smile and not having teeth, or going out with your friends and being conscious of your breath? You know, the teeth affect people in a tremendous way. It's so core to our appearance. You know, when you look in the mirror, when your friends see you, what does a nice smile say? When you see somebody with a nice
happy.
smile,
They're positive.
they're happy, they're positive people, they're good looking.
Healthy too.
Yeah, and what do people equate with dentures in the glass? My grandparents, being old, everyone's biggest fear is being in the nursing home and having to take their teeth out, losing their teeth. So again, people would go through this because who wants those consequences? Who wants to lose their teeth? Yeah, so people would go through that, but
So
who would
those
want to
black
lose their
things,
teeth?
those are stitches.
Those are the stitches that hold the gum back, and then after a week or 2 weeks, the gum knits together back with the root of the tooth and back with the bone. So there's more root exposed many times, there's some recession, but the pockets are shallow and it's cleaned out.
So the surgery, and we'll call it the old surgery that's being done every day, is you're scraping it out, you pull the gums up, you scrape out the diseased tissue, right? And then you wait for it to heal back. Okay, so now you have the laser.
Right,
So the laser comes in.
So here's an example. Here's a picture of someone before we treated their disease. And the gums are puffy, they're red, they're swollen.
Wow.
And this is a person that hadn't been to the dentist in years and years and years. And as happens many times, they know they have a problem, they're afraid of what the solution to that problem is going to be, so they stay away, and the problem only gets worse.
Other than the obvious, which is, I guess, very strange looking teeth and gums, what else is going on there?
Well, what you can't tell from the picture is that that person has bad breath, that every time they chew, that their gums start to bleed. So sometimes they go out to eat with a friend, they're eating whatever they're eating, and their gums will start to bleed. They'll dab their gums on a napkin. Sometimes the teeth get loose, there's so much bone loss, and then people can't chew the foods that they want to chew. So this person, Randy, has bleeding gums. They'll go out to eat or they'll brush their teeth and the gums will bleed. Imagine going out to eat, having something crunchy like a cracker, or eating an apple and looking in the apple and having blood be in the apple.
Really?
That's what this person had. Bad breath, the teeth start to get loose. So you can see, and if you look here at the bottom of the picture, you can see that the root is starting to be exposed. So when someone has part of the root exposed, the only way that's going to happen is if they've lost bone around the teeth already. So sometimes people have recession on the teeth and they think, well, that's normal, I just have a little recession. There's no way to have recession unless there's been bone loss around the teeth.
So when you see recession, gums receding, they're losing bone.
That means there's been bone loss around the teeth.
From this bacteria? Am I calling it right?
From the bacteria. And the thing is that this many times can be treated. We can treat it with the laser. But if it's not treated, it ends up resulting many times in the loss of those teeth.
So in this case, what do you do?
Well, so in this case, we treated this person with the laser. Let me show you this picture. Now, this is right after the laser treatment was done. And you can see there's no stitches in place. The whole area isn't all disrupted because, again, the laser is very, very selective in what it does. So it goes in, it kills the bacteria, we remove the tartar, it seals the gum back around the tooth, all with no discomfort. The person's numb, and afterwards, again, just a Motrin or a Tylenol is all they need. And now let's fast forward 2 weeks down the road. Look at the change in the gums that this person has.
Yeah. So it's gone.
Yeah.
diseased tissue, for the most part, I mean, you got most of it, is gone.
It's gone. Because the bacteria has been removed, the body can take over. You know,